than 100 years ago. We, as the way we have lived and how we are really not used to being told, stay home, wash your hands, wear a mask, socially distance. So it's been a very difficult time for individuals. And so when all of this happened, we realized that we were dealing with SARS-CoV-2, which has been called COVID-19, which is the disease that the coronavirus causes. We may remember SARS-CoV-1. Many of you may have been around and remember SARS. The thing to remember about SARS-CoV-1 is that it was over in 5 months. Maybe about 8,000 people got affected. And really, when you think about it, all 39 cases in the United States were travel related. They were not really, and SARS went away quick. SARS-CoV-1 came and it left. And so it was a very, very good thing for everyone that it didn't have this kind of potential worldwide spread. Now, SARS-CoV-2 is very different. It's a novel virus. It behaves differently and has made it very difficult to predict how it will behave in the future. There was some hope that it may go away in the warmer months, much like the viruses that cause influenza A and B sort of circulate more during cold times. We're not seeing that. We're seeing it just as potent during warm months and cold months, which doesn't bear well for what we think we will see in the future. And as you know, the numbers in Summit County have been ticking up, and we are concerned. Now, let me just explain a little bit about the differences in those two viruses, and this will help maybe get you to understand where some of these recommendations have come from. We have told individuals to wear a mask, separate 6 feet, stay home if you're sick, wash off surfaces quickly, and really just socially distance as much as you can. And what we are finding is this SARS-CoV-2 virus, when you sing or you cough or you speak loudly, you expel the virus. It falls probably within, at the most, a half hour to a surface, and it stays there. And that's why there is this recommendation to wash off surfaces frequently. Because if you cough or sneeze and you aren't covering your cough or sneeze, it lands on a surface. This SARS-CoV-2 is mostly replicated in the upper respiratory system, meaning that it's here. And so when you cough or sneeze, you have a lot of virus to cough out. The first SARS-CoV-1 was replicated in the lower lung. So it made it far more difficult. It was much more difficult to spread the disease. But this disease is much more easily spread. So that's why the recommendations for frequent hand washing, wearing a mask, and staying the 6 feet apart are so important to try to help stop the spread of COVID-19. We originally were telling individuals don't wear a mask, but that's when PPE was in short supply. And they were fearful that people would really go absolutely insane and buy every scrap of PPE there was on the market. So the recommendation was not to wear a mask. However, the recommendation now is to wear a mask. The governor's office has instituted the levels of red, orange, yellow, and then if you really get a lot of COVID, you'll be purple. But Summit County is currently in red. So what that means is there is a mask order in place. And with that, meaning there's a mandatory mask order, you have to wear a mask when you're outdoors, cannot socially separate 6 feet, or when you are in any sort of a business, you have to be there. You have to do that. So with masking, we're encouraging individuals to please try to always wear a mask, separate 6 feet, and there might be some business questions here about working in your own office, and we can answer all those at the end. So that's pretty much what we're dealing with as far as like a virus. We don't know a lot about it. There's there's vaccine for the disease in being actually created or, developed. But right now we do not have a vaccine that works, nor do we have a treatment for COVID-19. We also cannot predict who gets sick, and we cannot predict how they will do. We have seen very young people get very ill. We have seen very old people not get illness very much at all. So it really just depends. We don't know exactly what happens when people get COVID-19. Let me talk a little bit about long-term though. What we are finding is that some individuals really don't do well. They don't recover well. What we have happen is those individuals may get over the disease, they may survive, but they are not doing well as far as they have system involvement, they have any number of issues that continue to happen when they are, once they recovered from COVID. So what we're having are people that are getting increasingly ill and staying ill for longer periods of time. So let me talk a little bit about numbers, and this might, we can tell you where we're at Summit County-wise. What we currently have in Summit County is about 2,570 cases of COVID-19 that are confirmed. Right now, unfortunately, we've had 212 deaths. 161 of those deaths have been related to a long-term care facility, meaning somebody could have been in a long-term care facility or someone could have resided in a long-term care facility. With that, right now, we have about 24% African American. We also have about 52% white and about 16% Asian. So you can see it disproportionately affects our minority communities. And so with that, I want to say that right now we're seeing an increase in the numbers, and we knew we would see some increase when things started to open up again because people would be back together again. And that's always concerning because if you don't socially distance, if you don't keep the 6 feet and wear a mask, you're going to see spread. COVID-19 is extremely contagious. And so with that, we're hoping to be able to have individuals apply all of these techniques that we know work, and we'll see this virus start to level off sometime, hopefully so we can get our kids back in school. It's a real struggle for these schools to try to decide to put kids back in school when they are not sure of their safety. The next thing I wanted to talk about a little bit with you was testing. Testing has been an ongoing issue and an ongoing problem. And quite honestly, from the beginning, we have struggled with the availability of testing. At first, you may have heard the reagents were not available, the test swabs were not available, and that's because this pandemic is worldwide. And many of the individuals who, or the countries that manufacture the test kits, the reagents, any of that, it couldn't be. Italy made almost all the swabs. The reagents came from China to be able to run the test. And so because of the shutdown, there was not the availability of the test kits or the reagents to run the test. So we had a great deal of difficulty. We also did not have PPE. The personal protective equipment was in short supply because everybody around the world was buying everything. And so when we had this sort of, slow transition across the country, we really had a hard time getting all of the supplies everybody needed to be successful. But our hospitals in Summit County made a huge sacrifice, and they stopped elective surgeries. They did everything they had to do to try to get ready for a surge in cases. That because we did all of the social distancing, we shut down bars, restaurants, we didn't see the big spikes that a lot of communities have seen. So we were really lucky. And so with that, I mean, the testing was adequate to meet what we needed to get done for the hospital systems. Well, now they are reopen again. The hospital systems are reopen. They are doing elective surgeries again. And the problem we're having again is some of the availability of testing. We, because of the South, Florida, Texas, some of those states, there's a lot of tests being diverted there. We do not have the ability to get a test back in a reasonable amount of time. We've really struggled with this lately. And we're looking for solutions and trying to figure out how we can get around the lab capacity issue. We don't have enough testing that we can get back in a reasonable amount of time. I mean, if somebody goes and gets a COVID test because they have symptoms, we would like that test to be processed within 24 hours, 48 at the longest, because then we can know that person has a problem. We know that we can isolate and quarantine, and we can get that person healthy. What's happening is people are wanting to know they're going to get a test, and it's taking 14 days to get your test back. So when that is happening for 14 days, that person is going about their business typically, and they are spreading disease if they are in fact sick. So we are looking for solutions to try to create more testing available for the communities. We've done a couple of large stand-up communities in areas that were hard hit. We're looking at some ongoing testing here, and we're looking at some different strategies, trying to work within the confines of what our what the lab capability is. And I don't know, and they've always, from the beginning, prioritized testing for healthcare workers, first responders, because they're the people taking care of all of us. So we don't want them to get sick. And basically, the sickest of the sick got tested to begin with. And we may be back to that fairly soon if we don't see these numbers start to drop off. The next thing I just want to talk briefly about is travel. When this whole thing started, the state of Ohio, we had quarantine restrictions. And if you left the state, you had to come back in quarantine, and travel really wasn't encouraged. The governor's office lifted that restriction, and basically what happened after that was when they lifted that restriction, they found that people started to travel a lot. And I can tell you, there are no rules or laws that say, you can't travel, but I can tell you we have had a lot of disease related to travel since it opened up again. We've had individuals on airplanes, we've had individuals who have traveled to Arizona, to Florida, Myrtle Beach, and have come back positive. I am not saying that people that travel should absolutely be forbidden, but what I would tell you is you've got to be smart about travel. If you travel, there's something very different about going in a car, driving to Myrtle Beach, staying in a condo with your family, and not doing a lot of things. And there's something very different about flying to Miami, spending every day out in a bar without a mask, hanging out, where you're going to have much greater risk. So I'm encouraging everyone in this call to be very conservative in your travel and to weigh your own personal risk. If you have underlying health conditions, if you're at all compromised, traveling right now is not a good idea unless you know exactly where you're going and who you're going to be exposed to. The problem with flying is flights connect from all over, and individuals get on planes from all over. So you really don't have a good handle. It isn't like you're flying only with people coming from the area you're coming from. They're flying, you're getting people from all over. So I encourage safe travel. It is a problem right now if you are not careful. The next thing I want to talk to everyone about would be schools and businesses and reopening and where we're at right now. There are, and many of you may have read some of these things or have had them, there are separate pieces of guidance for every sector. So the schools have guidance, businesses have guidance, there's Dine Safe guidance, all under Reopening Ohio, a safe reopening. And each of those sectors have guidance that they're to follow. However, it isn't that clear cut, and it gets kind of confusing for most people. What we have seen is, Dine Safe is very clear. You can have people in a restaurant, you can have people in a bar, they have to stay 6 feet apart. They have to stay in their seats. You're not allowed to stand at bars. You're not allowed to, hang out and all of that stuff. You have to really, and there are some like special occasions like weddings or weddings or large dining experiences like catering. There's a 300-person rule. You're allowed to do that. But then again, you can't, the county fairs are allowed to operate with restrictions in place. They have a special order, but you're still not allowed to have a 10-person public meeting. So it creates a lot of confusion for individuals, and people are very concerned. And to be honest with you, frankly, they're angry that some sectors are allowed to operate and others can't. But the rationale that has been given from the governor's office is that you can't open up everything at once. So let's open up a few things, let's see how it goes, and let's continue to open up things. The reasons behind the weddings were because a lot of people had weddings scheduled and they had to pay for them. They had already paid. Some were not giving back. Some were not giving back their money, and so they had to postpone it or delay it. And so that was really what the fairs have a very strong lobbying committee, and so the fairs were with the governor and saying that we had to open. It's people haven't had anything to do, so they're allowing the fairs to open. Quite frankly, it's concerning that we just have to be smart for ourselves and for everyone around us. The fairs could quickly get out of control. There's been a lot of individuals within the state trying to stop fairs from happening, and that may happen. I don't know. The governor has a press conference today at 2 o'clock. We expect that he'll put a statewide mask order in place. I am not sure. We have heard that sort of through the grapevine, but it would be a good thing. We need to have a statewide mask order until we can get this under control, and or there is a vaccine that comes through. A vaccine will make it much easier to live life a little more normal than we are right now. So I wanted to talk, the very last thing I wanted to talk about with you would be the words quarantine, isolation, and contact tracing. Let me just sort of say it. I'll tell you like the definition of each, and then we'll kind of talk about how they interplay. Isolation happens, it's public health rule in revised code that we can isolate people when they are ill. So isolation applies to sick people. So when you have an active disease, we have the power to isolate you and say, stay home, stay away from people, you could spread the disease. Quarantine applies to individuals who have just been contacts or who don't have active disease yet but could. And then the contact tracers are people that actually follow up and try to help. They try to help the families be successful in staying in either quarantine or isolation. So they call them every day, they check in, they make sure their symptoms aren't worse, they make sure they're doing okay. and they make sure they can have somebody who can help them during that time period, because they may need food delivered, they may need some medications, they may need any number of things, or that they have the ability to get that done. So we work closely with all of the contacts. So if you are a case, if you are a confirmed case of COVID, you are going to be placed into isolation. Let's say you live with 3 people, they are going to be put into quarantine with you. We're going to tell you all to stay home. You all need to stay home. And then what will happen is once you're all home, we will then assess when the symptoms started, when the symptoms began. And now there's new guidance from CDC that says you have to be fever-free for 24 hours, and it has to be 10 days since the beginning of your symptoms. So what we have is people can actually get out of isolation a little sooner than people who are in their family members who are in quarantine, because we know the people who are in quarantine clearly have been exposed. And during that 14-day period, anytime, they could develop symptoms in the virus. So it's essential when people are in the same home in isolation and quarantine that they try to actually really separate in the house if possible. So when we, and really try to, as far as separation, use a separate bathroom, use everything. Try to stay away from each other as much as possible so that the other persons don't get exposed, okay? So let me talk a little bit about just general what happens in a workplace. Okay, so let's say you're in a workplace, and right now, currently in the workplace, there actually are employees have to wear masks, okay? However, there are some exceptions to that. Like, we have really told a lot of our food service individuals that we come in contact with, it's probably not safe to wear a mask around a grill or where there's a lot of heat. And so it just depends on what kind of work you're doing. Now, there are different kinds of masks. Now, certainly if you work with chemicals or something that protects you from chemical inhalation, that's different than just wearing a mask because of COVID. But in general, the specifications are that it's job specific and that you need to wear a mask if possible. Now, if you are sitting by yourself in your office or in your cubicle, you're allowed to take off your mask, and as long as your area is confined, you're allowed to sit by yourself. And then when somebody comes into your office or into your cubicle, you should put on your mask. But it depends really on the kind of business you are and what you're doing. But the idea is that employees should wear masks at all times around each other if there is no other reason to not do that, okay? So the question we always get 100 million times a day, and it's a good question, because I don't think there's a person on this Zoom call or there's a person in the world that likes masks, okay? I haven't found them. They're pretty uncomfortable and they're pretty dang hot in this weather. So we always get the question, can you just wear a face shield? The recommendation from CDC, the current guidance states no. Wearing just a face shield is not the same as wearing a mask and a face shield. However, for school environment, some children need to see your face. They need to see your lips move to talk, to learn to speak, to read. So there is some guidance that says if you're 6 feet apart in front of a classroom, you can actually just wear a face shield. And if children are close to you, then you would put a mask on. But in general, the requirements are a face shield with a cloth face covering, or it's a It's just a face covering, like a cloth face covering. And so the idea is that a homemade mask isn't perfect. It's certainly not medical grade, and it's certainly not, what do you call, an N95. An N95 is fit tested, and so it fits your face. It's very tight, and it really helps stop the spread of the disease. But the idea is that there's a question in the queue that says most homemade masks and medical masks do not protect you from getting or transmitting, so why wear them? But it does stop transmission. What they have found is by wearing a face cloth covering, if you cough or sneeze or even breathing or speaking, you don't transmit the virus. Now, there is some other literature that says wearing that face covering probably gives you 20% maybe protection. It doesn't give you a ton of protection from a virus because viruses are very, very small. That's why everybody should wear a face mask so we don't spread the disease to each other. So I wear a mask to protect the people around me. The people around me wear a mask to protect me. So I know it's hard to get your hands around, but quite honestly, it makes a big difference in how much of the disease is actually spread. And then again, I want to go back just to a minute for the coworker question about when do you quarantine and how long. So basically what it is if a coworker, the 10 to 14 days, the reason it's ambiguous on the website is what I was talking about earlier. The 10 days applies to individuals who have active disease. So once you've been diagnosed, you're confirmed, you have COVID-19, you have to be afebrile without fever for 1 day. It used to be 3, now it's just 1. And you have to be 10 days since the first beginning of your symptoms. And so that person who's actually had the disease, we are more confident about. The 14 days then is for people who are just basically at home because they were in contact with somebody, and we don't know when they're going to get the disease. Literature tells us right now that sometime in that 14 days, if they're going to get it, that's when they're going to break. You're the most contagious those 24 to 48 hours before your symptoms start. So that's why we want people to stay away. We want people to stay away from each other and to stay away from the work environment and to stay in the home so that it's not spread. So I want to go back here just one more minute, and I want to just make sure that there's a question here about wearing a face covering in high temperature, high humidity times. To be quite honest with you, that is a personal thing, but I mean, it's very difficult to do. I mean, some people can do it. I've seen people do it. Other people cannot. But generally, it's not recommended that at high temperatures and high humidity that you do wear a face mask. So there's a question here that says, I'm under the understanding that the virus can be exhaled from the filtering device on N95 to others, that it only protects the user, not the people around the user. To my understanding, to my knowledge, that is not true. I have never heard that. N95 that are NIOSH approved are absolutely supposed to be both transmittable. You cannot transmit a disease or receive a disease while wearing an N95. In the hospitals, you're seeing sometimes a face mask, you're seeing an N95, sometimes a surgical loop, but you're seeing an N95 with a face shield. A face shield is a moisture barrier that allows you to wear that N95 longer. And so you could take that N95 off after your shift, put it in a brown bag overnight, and then wear it again the next day, because then that helps conserve PPE. And because we were short on PPE, people were doing other things to try to make sure we could save the PPE and use it more than once. So I'm going to stop there with all of the good and bad news. And I'm going to just say a few things now. I just want to talk a minute and say that COVID-19, the pandemic that we have now, has been one of the greatest fears in public health. And it's because, we live amongst animals and other creatures, and there are zoonotic diseases that are spread back and forth. I cannot encourage everyone on this call enough to take this seriously and really try to help us get this under control. Because I have to tell you that it's going to be very difficult for the next 6 to 8, 10 months to a year until this gets through this. But I have to tell you that if we don't, we're going to have a lot of disease and we're going to have a lot of death. And we don't want either of those. And we're fortunate in this community to live in an area of really high quality healthcare. You don't always get that. Where other folks live, we're very fortunate. So much more fortunate than rural Ohio or other parts of the country. But we still have to take it very seriously and quite frankly, use our resources conservatively so we can get through this, all of us together. And I'm glad to answer any questions. There are a couple more in the actual chat box that I didn't get to, and if you want, I can take a minute and answer those right now.
Yeah, that would be fine if you are willing. I can pull those up or I can read those to you too if you want to comment to those. It does look like there's a lot of questions about masks and about heat. That seems to be a big concern, especially, in summertime and if folks are far enough apart, sometimes they're not even around anybody. One comment or question had said, well, is a face mask better than nothing if it's too hot to wear the face covering? So like the face shield, is that better than nothing, or would that be, better than nothing basically? And then there's there was another one that talks about the heat and not being air conditioned, which is, most of our manufacturing, which is what most of this group is here. And so just concerned about the issue of heat stress or heat related illnesses while wearing a mask. So I know you kind of already talked about that, but I guess, anything you have to add to that, and would a face shield be better than nothing, was one comment or question I saw.
I would say a face shield is better than nothing if you're 6 feet apart. If you're not 6 feet apart, then no. And even the guidance states that one of the best things you can do is stay 6 feet apart, wash your hands often, and don't touch a lot of stuff. You touch doorknobs, you touch surfaces, and if somebody's touched it and coughed on it or sneezed, you're going to pick up that virus. And then you touch your face, and then you get it. So I would say yes, if you can stay 6 feet apart, a face shield is better than nothing. But let me say this though too, in those hot environments, it's really hard, it's very difficult to keep a mask on. It is. And that's why that social distancing, frequent hand washing becomes important. You're not out of compliance because in the orders, there are sector specific, and it says that if it is difficult or you cannot do it because of the kind of work you're doing, then you don't have to wear one. So you're not considered out of compliance. But you want to think about the safety of your workforce at all times. There are some lighter masks. I think I've been through about every dang one they make. I have not found one that I wear them, but they're really hot. And if you're in an environment that's 85, 90, 100 degrees inside, I cannot imagine that you could wear that long without starting to suffer from heat exhaustion and anything else that goes with it. But the good news is you won't be out of compliance. Just try to be very careful with your employees.
I was in a call yesterday, and it was similar to this, but it was with Medina. And another question that came up a lot was if you have office workers that are sitting, either they have high cubicles or they're sitting, there's two people in the office, it's in a big giant room. Do they need to sit there with face coverings on the entire time that they're working?
If they're together in a room, it depends on how big it is. If you can socially distance 6 feet and you're working in your area, say, no, you do not have to keep that face covering on. But if in fact you're going to get up and interact, or if you're back and forth, the actual sort of contact, sort of keep in your mind, the CDC says a contact is somebody you have been around for 15 minutes without, in a close area, all right? And it doesn't mean if you have a mask on or not, because we know these masks aren't 100% protective. So anytime you're in the work environment, you should be thinking, staying 6 feet away from your other coworkers, and when you're up moving around in common areas like going to the bathroom, getting water, whatever, you should have on a face covering.
Yep. Okay. I do have another question in here. The City of Akron has already issued a mandatory mask order and had indicated that there was enforcement mechanism as well. Do you know anything about that, or is there any information about the enforcement piece of the mask order for the City of Akron that you can share?
Yes. Basically, the order was written as public health as the enforcement entity. And the reason that was done that way was that's what the state order said. When counties go to that red designation, enforcement is to the public health department. But for us, enforcement isn't like going out and handing out tickets, okay, or citations. Enforcement for us is really the education and outreach to help that business be successful. In the Akron ordinance, there's a $50 fine for individuals, and there's a $250 fine for a business. I kind of liken it to the Smoke-Free Ohio, where they used to find businesses when we caught people smoking. They would let people smoke in their businesses and they'd get fined. But, people will get used to this, and we're hoping we don't have to fine anyone. We will work with the business. We will help them. We will try to help the individuals in the business be successful. We have a lot of complaint-based programs. People complain all the time about restaurants, their neighbors, cats, rats, bats, you name it. We get complaints all the time. And when we get those complaints, we investigate each one of them. And then what we do is and some of them aren't true. I'm just going to be honest with you. We get a lot of complaints about employers, but they are absolutely unfounded. Only to find out they're just disgruntled employees. They were mad and they thought it would be funny to get their employer in trouble. And we do find that. So we don't automatically go out and say, oh, the employer's wrong, they're treating their employees badly. We really do go out and try to figure out how to help them be successful so that they can do better at trying to comply. I don't think anybody gets up in the morning and, oh, today I'm going to spread COVID-19. It's just a matter of being able to understand what you can do and what works. And sometimes we have to be really creative with businesses to help them be successful. Like call centers are really tough because people sit close to each other. So how do you figure out a call center? So we've been able to work with them as well to help them be successful.
Awesome. No, absolutely. We have a lot of good employers that are sitting on this meeting too, so I'm glad to hear that you take that same standpoint as we do. For sure. We do have another question, and I think this is a really good question. What is the process when an employer reports a positive COVID case? Should the employee call you? Should the employer call you? What does that whole process look like?
Well, actually, in the last governor's order, the governor put a line in there that says it's the employer's responsibility to report COVID to the health department. So we have on our website, if you go to the COVID, there's like a red banner across the top. And then if you scroll down a little bit, there's some boxes. And one of them is report a positive employee. Employers, report a positive employee. So what happens is you go in and you report that to us on that like spreadsheet with a Google Doc of some sort, but you put that in there and then that comes to us and then you're done because you're immediately then notified via email. You get information around it, cleaning, what to do, that sort of stuff. Then what happens is and the reason the governor put that in is it's got a good public health reason, is because if you're in these big companies, there might be 25 supervisors, 30 supervisors. There might be different HR people assigned to different parts of it. So let's say this firm has one person with COVID that one person reports and somebody else reports another. They may never talk to each other. That helps us identify if there are any outbreaks. Because if we're seeing a lot of cases, and this is what you saw like in the meatpacking plants, and you've seen it in some of the nursing homes, if we don't get all of the cases contained, and then what we can do, work with that business to see if they need testing, what they need to help them make sure they don't have a bunch of cases that wipes out their workforce. We don't want their workforce wiped out because then they have no one to come to work and everybody's sick. And so that's why the governor put that in there. It isn't like it was just really to help local public health determine if there's more than one case. And we have found it that way. Sometimes an employer will report one and then we'll find another one within the same organization that they didn't even know about. And so that's helpful for us. And then what would happen is if that person, if you reported a positive to us, we would be in touch with that person to find out who the contacts were. And then we would talk to the employer. So let's just say I work at an Olive Garden. And then I talk to somebody and they say, oh, I work at Olive Garden, okay? And the employer is already reported to us. We will call and verify with that employer that they know. So it works kind of two ways. The employer puts it in, but then there is the chance the employee won't tell the employer. And so when and we want you to know, so when we find out where they work, we then call the employer and tell them as well. And a lot of times they'll say like, oh yeah, we knew, Johnny told us and we were good, we're okay. So we just try to have close that loop to make sure everybody who needs to know. Now, when a person tests positive in your organization, you can't just go to all the employees around them and say, oh, hey, Johnny Jones was positive. All you can really tell them is they may have been exposed to COVID-19. You cannot use the name because that's considered a HIPAA breach. You cannot tell them who is sick. And that's often when we call people, we have to say, somebody told us that you are a contact. And a lot of people say, oh yeah, I know my cousin, my sister, and so, you know what I mean? So it just really depends on what happens. But so there's lots of sort of checks and balances so that we can help employers know, and then it's the same thing that's going to happen in the schools. So we'll be able to help the schools.
Now, another question, can an employer or should an employer ask for a negative test before they allow people to come back to work?
I would say no, that's not the current guidance. And the reason is that they have found after having COVID-19 that there's a certain group of individuals that will have RNA, their fragments in their system for a long time, meaning the test will pick that up. It doesn't mean you're contagious. It doesn't mean you're going to spread it. But it could take a person 2 months to clear to a negative test. And it becomes problematic for everyone.
Oh, yeah. One more that I have, and then we will thank you so much for answering all these questions and giving us all this information. Actually, two quick ones. One is, should employers be taking temperatures now? And, is that something that is considered a best practice or a mandated requirement?
It's not mandated, but it is a best practice, simply because we know that temperature can be a first indicator. However, I want you to be aware, it is not the only indicator. There's a whole group of people out there that are asymptomatic that do subsequently test positive.
All right, and lastly is just a little more guidance on where to locate the employer notification option on the Summit County Public Health website. One of our members that was unable to find that.
Okay, it might be, and actually today it could be down because they're updating it. But what
Okay.
there's a COVID, like a red bar across the top that says COVID information or whatever, and then when you scroll down, it'll give you the employer, like it gives you like 4 or 5 options, and one of them is click on, it says report, employer report a positive employee. I don't know if you could find it or not. I could send you a link, Carrie, and you could send it out to everybody, honey, if you want.
Yeah, definitely. We could do that for sure. And then the other part of this is we'll have this presentation as well that folks can review if they have more questions too.
Yeah, and we're glad to send you anything you would like that would help you.
Okay.
And one other thing I want to mention, we did just get yesterday, I think it came in. We just got a bunch of thermometers. So if anybody needs a thermometer, they're designated for businesses. So I don't know.
Who can they contact?
I don't know what the actual distribution plan will be yet, but you could call, you could send an email. I'm trying to think of the best way to get you to be able to get it. You could call the help. No, I would tell you, just why don't you email Elizabeth, the one that you were in touch with on this, the Foster. Have people email and then we can get them, we can collect them and we can get it.
Okay, we're gonna send out a post follow-up to this meeting with the meeting link and information, and we'll put her contact information in there too, so they can reach out to her if they need to.
Yeah, that's great, and then I know we just got them yesterday. I don't even know what we got.
Okay.
You know, who knows?
All right, and we do have somebody that already put the link to the contact us in the chat that you talked about, so that was perfect.
Okay, great. Thank you.
Great members, great members. Okay, well, with that, I think we'll just do like a virtual, everybody give a virtual applause. Actually, you have a reaction button, and you can give a clap on your reaction button. I really appreciate you, Donna, being here. This was wonderful. The feedback already is coming in the chat, and it's really good. So I do appreciate it. If we can ever help you in the future at Summit County Safety Council, we will gladly love to get the word out for anything that you have.
Oh, yeah, no, we appreciate it as well, because we want folks to have good information. We want to help you. We want you open, because that's how we'll make an economic recovery.
Absolutely. Absolutely. Well, thank you so much. Sally, do you have anything you want to add?
I just want to thank you too, Donna, for the great presentation. And to the members, please feel free to provide any feedback on this meeting, as well as suggestions for future topics over the next year. If you have any great suggestions for us, we really want to hear it. So.
Okay, great. Yeah, we're glad to help. Let us know.
Awesome. Thank you so much.
Thank you.
And everybody's free to leave now. If you have questions for me, you can stick behind and we can spend a few minutes answering questions if you have BWC or safety questions. But Donna, you don't have to stick around for that. I really appreciate you being here.
Okay, thanks.
Thank you.